In a patient who has right-sided tumor and received bevacizumab-based chemotherapy up front and then has progression of disease, it really depends on that specific scenario about what to do, whether you would switch at that point to an EGFR inhibitor or keep them on bevacizumab-containing therapy. The one circumstance where you may consider using an EGFR inhibitor in those right-sided tumors is in patients who need a response, because there has been data suggesting an increased response rate with EGFR inhibitors and chemotherapy, even in right-sided tumors that are RAS wild type. But certainly for the majority of patients in which response rate is not always necessary, most people would favor continuing bevacizumab-based chemotherapy into second line. Maintenance therapy is something that we use a lot of in practice, even though there's not as much data to support its use. And I think that's just a matter of practically knowing how to take care of patients. We know that if you could keep going without any maintenance or de-escalation for several years, you end up having patients who simply are too beat up and unable to carry through with the majority of their treatments, both physically and emotionally. So maintaining, allowing some maintenance therapy intermixed, and I think in practice what a lot of people do, what I do certainly, is keep them on a 5-FU or capecitabine alone treatment with or without bevacizumab as a maintenance approach. And here at this meeting, we've also seen some data that perhaps EGFR use in maintenance may be the right thing for some patients, may be allowed to continue the disease stability without jeopardizing progression-free survival. So these are strategies that we need to obviously use more. They're strategies that are practically very important. But we don't, in the United States, I would say we don't typically do what is often done in Europe or Great Britain, which is give patients complete breaks for months of chemotherapy. That's not the most standard approach, I would say, overall in the United States.